Now the next question comes, how best to investigate gallstones. So if a patient comes to us with a history of pain in their upper abdomen, which is going to the back, they may come to a surgeon's clinic or to accident and emergency department. Mostly this pain is exacerbated by eating rich or fatty food. Most of us are very careful with the food that we eat, but every now and then we want to let this carefulness go away and enjoy the meal. And if it is rich, that can exacerbate or that can bring on the symptoms for the first time of pain under the right ribs, which go to the back. When we are suspecting this, we do a few blood tests, which are called full blood count and a CRP and liver function tests. The first two tests of full blood count and CRP, which is C-reactive protein, is done to assess if there was any infection as well. Simple pain does not require admission or any antibiotics, but if there was infection, then this may require admission or definitely it does require antibiotics. The liver function tests are done to make sure that there is no blockage in the tube or the common bile duct. We sometimes do serum amylase as well, which is to assess if one of the stones has given inflammation of the pancreas or pancreatitis, but one does not always need to do this test. Then of course an ultrasound of the abdomen is arranged, and this is a scan just done like pregnant mums. A bit of jelly is applied on the tummy and a probe is placed on the abdomen, and a thorough assessment of the liver, gallbladder, kidneys and various other organs is done, but specifically with the gallbladder to see if there are any stones in the gallbladder, and at the same time the size of the common bile duct or the tube which comes off the liver into the stomach is assessed as well to make sure that it is not widened. Pancreas may or may not be easily accessible on an ultrasound depending on the habitus of the patient or amount of gas present in the tummy, and one may not clearly visualize it. But at times we get useful information on the pancreas at the same time as well. And by these three tests, a doctor can decide whether the patient needs admission in the hospital or what sort of treatment they require. Other tests which can stay in the background are a CT scan of abdomen, that is mainly to check the pancreas and see if there is any pancreatitis or other issues associated with gallstone disease. And another test that we do is MRCP, which is an abbreviation for magnetic resonance cholangiopancreatography. So basically this is an MRI scan, and through which we get a great detailed assessment of the biliary tree. So not only we look at the pancreas, gallbladder and the liver, but with some specific setup or program which is within the system, we assess the structure of the common bile duct and the gallbladder in detail to see if there are any stones present within the common bile duct. And if there are, then these need to be treated urgently with a test which we call as ERCP, endoscopic retrograde cholangiopancreatography, or we can remove these stones concurrently at the same time as removing the gallbladder while doing the surgery, in which case we call this laparoscopic cholecystectomy, and we perform a cholangiogram at the same time, on-table cholangiogram or OTC, and we can explode the duct and remove the stones there and then in the same setting. So this is the way, or a very simplified checklist on how we assess and treat the gallstone disease.